Welcome to Uncaged, a show that celebrates thought leadership from today's top business leaders. The program provides a voice to amazing executives from around the globe who are shaping the world of business today and mapping the path to the commerce of tomorrow. Today, we're speaking with Steve Weichhand. Steve, how are you?
I'm doing well. How are you, Matt?
I'm very, very well. Steve, I'm excited to talk to you about probably the topic that has been at the center of everyone's thinking for the last couple of years. Steve is the EVP of Client Service at Divurgent, which is a company that's forging solutions to healthcare's greatest challenges. So we'll be delving into the topic of healthcare today and how that's evolving rapidly. But before we get there, Steve, tell us a little bit about yourself and your career.
Absolutely, Matt, and thank you so much for having me here today. First off, with this question, would certainly love to give credit to my family and the teams that I've always been surrounded by. I've really been fortunate to have some fantastic mentors. And the teams that I've worked with have been incredibly bright, hardworking individuals. So my success is a testament to them. One career theme, that really started from my childhood is to follow the path that allows me to make the biggest impact on whatever it is that I'm working on. Mm-hmm. And to follow that path, even if it's the one that's less traveled or harder to navigate. So I'll give you a couple of examples of that. Coming out of undergrad, I had a big focus on econ and financial math. So many of my classmates, they went to Wall Street in New York, and one might assume that I would follow. But I did pretty much the opposite of that. I went in a different direction over to the middle of Wisconsin to an electronic health record company called Epic. And Epic claimed that they would change the healthcare industry for the better. Mm-hmm. And I thought that was pretty interesting. So this was at a time just prior to the government infusing a lot of capital into the market, which made things even more interesting. But I believed in the ability of Epic to make an impact on healthcare, and I still believe that today. As another example, I left Epic to go into consulting, where I could really focus on maximizing the benefits of technology. And what I found both at Epic and in consulting is that in consulting, you're able to experience many different ways of doing things. One thing that I say is as a consultant, you can experience as many different organizational processes in 2 years as it might take a FTE a couple of decades to experience. And that's not to say there's anything bad about being an FTE, but it just shows one element of value of being a consultant or working with consultants.
Yeah, no, it's really interesting. I think consulting is for the curious, right? It's for people who love kind of complicated, gnarly problems and, getting approached with different ones all the time. And certainly working in the healthcare space right now is one where there are endless challenges and endless opportunities. And so tell me, this background has led you to Divurgent. Tell me a little bit more about what you guys are doing there.
Yeah, absolutely. So we really have a large breadth and depth of solutions that we offer specific to healthcare. So we're 100% focused on healthcare. And we're in both the payer and the provider verticals. So we're across the spectrum from implementation to managed services to advisory. But one area that I think is really exciting, that I'll take a moment to talk about is that we have a number of active and early stage digital health engagements. And this term, digital health is broad and often confusing unless you're deeply embedded in it. But ultimately, digital health is really any way that a patient can self-service interact with a health system or a health plan. So think of everything from finding a provider to scheduling a visit, confirming an appointment, paying bills, etc.
I'm all for all of the digital health. I got to tell you, over the pandemic, I think the exciting thing for everyone was perceived perhaps as the acceleration of solutions that were digitally health related. Perhaps also things like telehealth was quite interesting for many folks. But tell me a little bit about what you're seeing in the marketplace today. What are the areas that are moving forward quickest? And then also, what are the areas that you find most interesting from a divergent perspective?
Yeah. Good question. And I'll continue kind of on this, digital health, topic.
Yeah.
You know, the industry spent the last decade plus really getting the infrastructure in place to capture data. So I'll build on that. I have a saying that you can improve what you don't measure. And this is true in healthcare, as well as other industries and in your personal life. So previously, a lot of the metrics and measurements within healthcare kind of sat behind closed doors. It was abstracted manually from paper charts, and chief quality officers and chief financial officers saw them, but it really didn't go much beyond that. So the democratization of data, which is a concept that I first read about in a book, The Patient Will See You Now by Dr. Eric Topol. Mm-hmm. The idea behind the democratization of data in healthcare is that when the consumer, or when patients and members, using healthcare specific terms, when they have the data, they're going to be more empowered to be responsible for their own care. They might be more selective about where they go to seek care or how they live their lives. And that data is going to drive, and is already driving, some competitiveness across providers and payers. And I believe that's really going to start moving the needle on how the healthcare industry functions today.
Yeah. I've heard one thing though. It's interesting, and I'd be curious kind of your thoughts on this. I can see this amazing path that you've been on, Steve. You have a strong math and data, digital background, and you're absolutely right. There's this just treasure trove of information and data that's kicked off in the healthcare space. But I think perhaps one of the areas that you guys probably help break down are some of the fact that these sit in silos, right? That they seem to kind of not talk to one another. How do we get past that? How do we get past some of these barriers and make some of this data work synergistically for all of us?
Yeah. First, I think it comes with a mindset change. Certainly there's some regulation that's a component of it. Mm-hmm. And the technology, really follows, those two things. So certainly there's these great systems that we've put into place, across insurance companies and health systems. It's collecting all of this great data. But in order to be interoperable, you need to, one, be incentivized or have a good reason to do that. And I think we're seeing that, in the deployment of more capitated payments and ACOs and similar types of structures. Those programs, incentivize, these external, to a health system entities like reference labs and physicians to share that data so they can better care more holistically for the patients or members, that they're serving. So one is, changing kind of that mindset in the regulatory components, and really where we at Divergent or Divergers, come into play is in making, the technology work in the way that the business needs it. Mm-hmm. So there's certainly, a lift required to set up the integrations, integration points to standardize and normalize the data, and have it in a place that's accessible. So certainly a lot of exciting work in that space today.
Yeah, definitely kind of resolving some of those technological issues to make it streamlined and, I suppose, pairable in the right manners. So let me change gears a little bit and talk about the last couple of years, Steve. I would say, I imagine you are the person that have probably receive the most questions from your relatives on, Steve, what's going on in the healthcare space? How are we going to handle this pandemic? Tell me a little bit about the challenges that you guys have seen and perhaps the opportunities that have appeared coming out of this pandemic.
Yeah. As a company positioned to solve healthcare's greatest challenges, there really hasn't, from what I recall, been a more interesting time, in recent history, to do just that, to solve those challenges. So certainly, at the onset of the pandemic, there was a lot of uncertainty. There were projects that were put on hold, so our client partners could really focus on caring for patients. So we saw some of that, but we also saw a lot of opportunities in the midst of the pandemic, at the onset of the pandemic, to really step up, to the challenge and find great solutions to the problems that our clients were having. So one that really stands out in my mind is we had a client in the greater New York City area that had close to 100,000 in-person clinic visits.
Wow.
That were scheduled in the months shortly after, what was it, March of 2020. And they came to us and they asked, we need to rapidly get these patients, over to telemedicine. And so we were able to find a solution to collaboratively, work with them to stand up in a period of 48, 72 hours, patient outreach center, to call those patients, confirm that they're comfortable with a televisit as opposed to in-person, make sure that they had the technology in place to support that. And one of the most interesting things that we did with that project is we were actually able to staff that patient outreach center with out-of-work restaurant workers. So we took one industry that was, very negatively impacted, the restaurant industry, and we're able to, keep them employed, with an income to help another industry that was very impacted by the. So it was this really great uplifting project, to be able to support.
Yeah, what a great case study. And certainly people that know me know that I'm obsessed with solutions that are kind of like one stone that kills two birds types of ideas. So I love the fact that you guys were able to do that. But Steve, let's look at this year a little bit more closely. Here we are in 2022. Knock on wood, we're coming out of this pandemic a bit now, and we're starting to be able to live life a little bit more normally. What's on the docket for Divurgent this year?
Yeah, great question. So we as a company are experiencing a lot of growth. So we came out of the pandemic strong. And I think a lot of those projects that I referred to that were, put on hold, as organizations really tried to make sure that they were caring for patients, have really started up again. So we're growing at a great clip. And in my role, I have the great opportunity to work to build the teams, that will support that growth and support our client partners. So we're really focusing in on, bringing in the best and the brightest in the industry. And we've done quite a bit of that and will continue, throughout this year. We're really doubling down on talent, and, talking a lot about, culture and how we can not just attract and retain and develop talent, but how can we inspire the team, to really, get them energized and excited about the work that they're doing that's tied to our mission, which our mission is, serving our client partners, and the communities that they serve. So we're working throughout the year, not just to, build up the team in many different ways, but to tie the work that we're doing today, to our ultimate mission, which is, linked to serving the communities of our clients.
Communities. That's really nice. And I would say that certainly while healthcare was on the minds of everybody over the last couple of years, the acceleration of this digital agenda that you were talking about, focused on really data-driven solutions, data integration, data ideas, using strong technologies like the solutions that you and Divergent are putting in place, is first and foremost on a lot of discussions right now. People are really, really going into this space, and it continues to be arguably the most exciting industry to work in today. Steve, if somebody wanted to learn more about what you and Divergent are doing, where should they find you?
Yeah, so certainly our website, divergent.com. We have a great social media presence across the main professional platforms, LinkedIn, Twitter, Facebook. So certainly would encourage anyone to, to follow what we're doing, across those different media outlets. And appreciate the support of those that are following and working with us.
Excellent. Well, thank you so much for being on Uncaged. We've been speaking with Steve Weichhand. Steve is the EVP of Client Service at Divergent, which is a 200+ consultant solutions provider. I imagine, Steve, based on all the growth that you've been telling about, it might be more than 200+ at this point, but there we go. It keeps on growing. And they're focused exclusively on the healthcare segment, which is an area that we've all had to think perhaps more than we ever thought we were going to have to think about in our lives over the last couple of years, but continues to evolve, continues to find a way to improve itself. And Steve and the Divergent team are working to make that happen. Steve, thank you so much for sharing with us what you're working on, and we look forward to having you back.
All right. Thank you, Ben.
Cheers.
Cheers.